Hi, I'm Tony Schrader, Chairman of the Putnam County Republican Party. And we're down in the office of our good friend, Senator McColley. It's always a great opportunity to come and visit him down in the State House. He'll let you come and see him too, but we're especially privileged to have a chance to talk with him today. Senator, thanks for making the time for us today.
Happy to be here.
In a busy schedule for you. We wanted to ask you the one question which has been on the minds of the voters in Putnam County and in our own case. The General Assembly overrode the governor's veto on your legislation, Senate Bill 22, to repeal the health orders. We were curious to know how that gets implemented and what kind of time frame. And any information you could give us about that, we'd love to hear.
Yeah, so constitutionally, when we pass the bill, it takes 90 days from the day we overrode that veto for the bill to take effect. And that's the only way we would have been able to change that is if we got 2/3 in both chambers, and our votes in the House simply weren't there for us to get 2/3 in both chambers to have an emergency clause for that to take effect immediately. And so the way this would work is that we will introduce a concurrent resolution, which is a resolution that must be passed by both chambers. It does not require the governor's signature, that would allow us to be able to rescind any existing health orders and in the future any health orders that may come forward. And so I anticipate on June 22nd or 23rd that there will be a concurrent resolution that may very well be considered by the legislature to revoke many or all of the mandates that are currently in place. And the reason I say that is because, you know, the beautiful thing about being in a state legislature is you have 50 laboratories of democracy across the United States. You don't need to reinvent the wheel. You can look at what other states are doing and you can figure out if it works or if it doesn't work. Well, in this case, there are many other states that have lifted their mandates already, their mask mandates, their dining mandates, any other mandate, host of mandates that may have been in place. And they are doing comparably very fine, and in some cases even better than states that have kept their mandates in place. And so one would be led to believe that the hype and the hysteria behind lifting these mandates is not really what it would actually play out to be. And so in that respect, I do know that there are members right now who are already researching and drafting resolutions that we could potentially put on the floor to lift these mandates. And so I think it's something that will generate an awful lot of discussion as we near that June date.
Yeah, absolutely. Well, and obviously it's critical to the people of Northwest Ohio, your Senate district, but also statewide. And you mentioned previously about other states, Indiana lifting their mask mandate some weeks ago. And we haven't heard the stories out of Indiana. I don't know if you've heard anything out of there that has caused them any real serious concern from a health standpoint. So.
No, and I think even if you look at our numbers here in Ohio, our cases are very low right now. The vaccinations, even though they've kind of slowed a little bit, one thing that is already prevalent is that the primary risk group that they've been saying all along is the primary risk group for catastrophic consequences, if you will, from COVID, is those people who are 60 and over. Well, if you look by Ohio's own data, those that are 60 and over, it's between 75 and 80% have already been vaccinated, which is why you also see our deaths and our hospitalizations down. You know, despite the fact that people may be loosening up a little bit in their practices. And so I don't anticipate that Ohio's situation would be any much different than what it is right now, or that it would be any much different, that much different than what other states have seen when they've lifted their mandates. Because, you know, let's remember when we got into this, it was first let's protect the hospitals, let's protect the elderly, and now all of a sudden we're in a situation where now we're being told we can only have so many cases. Well, that's not the way that I think this should be working. I think we should evaluate it based on the risk. And right now, with the riskiest subgroup of people already being protected, then there's no reason that we should be continuing with these overly burdensome regulations
in the first place.
And mandates.
Well, we've talked about it before. We greatly appreciate, on behalf of the voters of Putnam County and Northwest Ohio, all of your leadership. Yours and the president have at the very forefront of trying to restore this balance and this check on executive power in Ohio. And with you as the author of the legislation to get it done, we're proud of the work you've done. So thank you for that, Senator. Appreciate it very much. We've taken enough of his time today. He's got to go do the people's business now. So we'll see you next time.